The answer to your food allergies lies in your gut microbiome. In this video, I'm going to discuss why the incidence of food allergies is rising, what causes food allergies, and how one may be able to prevent or lessen their severity. The incidence of food allergies has been increasing over the past 30 years. 1 in 10 infants suffers from food allergies, and in adults it is 1 in 50. Admissions to hospitals for anaphylaxis in Australia, UK and the USA have doubled in the past 10 years. In children, it is even higher, with a 5-fold increase in hospital admissions over the same 10 years. So what are the reasons for this dramatic increase in incidence of food allergies? The main one is the change in diet with the increased consumption of ultra-processed foods, high in fat and sugar. If you have been following my other videos, you will know that the increased intake of processed foods impacts the gut microbiome in a negative way. The most important phase in the development of food allergies is in early life, when the microbiome plays a big role in influencing the development of the immune system and in developing tolerance to foods. Tolerance to food is when the immune system does not react to that food, that is, sees the food as safe. If the immune system is intolerant of the food, it responds with an allergic reaction, which in severe cases is anaphylaxis, or in less severe cases as diarrhea or vomiting or abdominal pain or skin rash, to name a few symptoms. Studies have shown that gut dysbiosis, defined as an imbalance in the gut microbiome, precedes the onset of food allergy. The gut microbiome composition from the first weeks after birth to 6 months of life plays a central role in the onset of food allergy. Now, a quick word on the gut immune system. The immune system continuously communicates with a wide range of microorganisms that colonize the gut and with the different components of food that are eaten daily. For those of you who have been following me in my previous videos, you would have heard me talk about the short-chain fatty acids, in particular butyrate, produced by the healthy gut bacteria from vegetable fiber. Well, guess what? Butyrate plays a crucial role here too. It influences the immune system in relation to food allergy. In the early weeks and months of an infant's life, in normal healthy development, the friendly bacteria in the infant is involved in the development and maturation of the immune system. The immune system learns to recognize the safe bacteria and does not react to them. The foods are also recognized as safe through the instructions that come from the friendly bacteria via the short-chain fatty acids. So the immune system is educated by the friendly bacteria to recognize what are safe bacteria and how to not react to foods. Let me repeat this very important point. The immune system is educated by the friendly bacteria to recognize what are safe bacteria and how to not react to foods. In the context of food allergies, butyrate plays this important role. It is central in stimulating special immune cells that have an important role in the suppression of inflammation and allergic responses. In studies, they have found that stool levels of butyrate are higher in non-allergic children compared with allergic children. High fecal butyrate levels in early life are linked to the protective effect against the onset of food allergy and into later life as well. Diet is a major factor in early life. It can influence not only food allergy but other allergic diseases as well. The influence of diet during the first 1,000 days of life is crucial. This window of opportunity ranges from pregnancy to the first 2 years of life. During this vulnerable period, diet strongly influences the gut microbiome composition and function. During pregnancy and lactation, maternal diet influences not only the maternal gut, but also the fetal gut and the infant gut microbiome. I will digress briefly to mention the other protective factors against the development of food allergies. These are vaginal delivery, breastfeeding, growing up in a rural environment, increased family size, and exposure to pets. Vaginal delivery exposes the baby to the helpful bacteria in the vagina that C-section babies miss out on. By growing up in a rural environment, exposure to other friendly bacteria in soil and farm animals is protective against the development of food allergies. Increased family size allows the baby to be exposed to a variety of bacteria from siblings earlier in life, and that is the same process with exposure to pets. So having a pet is protective against the development of food allergies. On the other hand, junk food-based diet and or low-fiber diet during pregnancy and lactation and exposure of children to antiseptic agents may lead to dysbiosis, reduced production of short-chain fatty acids with the resulting increased risk for the onset of food allergy. Now I want to touch briefly on breastfeeding. I've mentioned that breastfeeding is associated with decreased incidence of developing food allergies. One of the main reasons is that breast milk contains high amounts of butyrate. However, butyrate cannot be produced by the body, only by bacteria in the gut. So if the mother has a diet that's low in vegetables, there may not be enough butyrate in the breast milk to protect the infant. So it's important for the mother to have a good diet as well. One study showed an infant diet consisting of high levels of vegetables, fruit, and home-prepared food is associated with fewer food allergies by 2 years of age. Several studies suggest that a good level of adherence to the Mediterranean diet in early life protects against the onset of asthma and other allergies. The Mediterranean diet, as you may know, is composed of high levels of fibers found in vegetables, legumes, nuts, and fruit. The diet also includes olive oil, chicken, and fish, with a lower intake of red meat and sugar. On the other hand, the Western diet is characterized by a high consumption of fat and sugar and low consumption of fibers, which can lead to dysbiosis and the development of allergic diseases in children and adolescents. In my over 40 years of treating families, I have been privileged to see up to 3 generations within a family. I've seen mothers come in with 1 or 2 children with food allergies, and by preparing the mother for the next pregnancy, as I've just described, in the majority of cases result in a child with little or no allergies. In summary, the incidence of food allergies is increasing. A big factor contributing to the increase is a diet that's lacking vegetables and lacking in other unprocessed food. A Mediterranean diet has been shown to help prevent the onset of food allergies and allergies in general. On the other hand, a diet high in processed foods, including sugar and fat, can be a cause of the development of food allergies. Steps can be taken to prevent food allergies by following the Mediterranean diet, starting before pregnancy and right through till after breastfeeding, which should be for at least 6 months. The solid food for the child till at least the age of 2 should be high in vegetables and complex carbs. That is what the studies show. My comment on this is don't stop at the age of 2. Why not feed that way forever? Because other studies show that eating this way can ensure the child grows into an adult not subject to the development of chronic illness like diabetes, obesity, heart disease, and cancer, to name a few. I am Dr. Iggy Soosay. I hope you enjoyed this video, and I look forward to your comments below.